Thank you, Hakan. Can I have all the panelists come up to the front? We will slightly truncate the question period just to try to get out of here close to time. So maybe you can have a seat there or stand. And I'm going to have you come to the podium because I think the portable mic was not working very well. So a number of questions that were partly addressed by Dr. Nygaard just at the end, but this was mostly directed towards Dr. Wellington regarding which types of fats are healthier for the brain. A number of questions about coconut oil. Where do you get these types of fats, and can you take too much of them?
Okay. Thank you, Dean. One of the big challenges in recommending specific nutritional advice for what fats are important for the brain is that we really yet are not entirely sure about what dietary practices to use. Certainly the ketones, the fatty acids, these are a type of fat that will get into the brain. There's a lot of work going on, but we cannot make any specific recommendations yet other than to eat a heart-healthy diet. I'll stop there. Okay.
Questions for Dr. Shung. Is there a music study group going on now? And as well, do you ever see things like the Gregorian chant making a modern day comeback?
Well, first question is, at the moment, we do not have a music therapy study going on, although a colleague, Adele Diamond, has been looking at potential of using iPods in a nursing home. So I think she's looking at something slightly different using iPods, but I don't have a music therapy trial at the moment. Music therapists are available, and they can be available in many different nursing homes as well. You just have to inquire, and they can help arrange that. The second question is...
Gregorian chant.
Oh, Gregorian chant is making a comeback. Actually, there are a number of music that uses Gregorian chants. I don't know if you play video games. There are certain video games that uses Gregorian chants in some of the music sequences. But that's general trend I couldn't answer. I'm not music critic.
Question for Julie Robillard. This kind of comes up with one of the morning questions. What can be done about, real-world physicians making recommendations based on misinformation to their patients? What can you do about that?
What can we do about that? So if there are any specific examples, I think it'd be important to bring them to light. It's not impossible that you might hear something that you're not sure about. I think the best way to address that is to corroborate with another expert when possible. But there's a lot of misinformation out there, and it's very difficult to tease out what makes sense and what doesn't make sense. But with some of the tips that I've mentioned, and with these resources that are in place, for example, the Alzheimer's Society, if you're not sure about something, they'll be able to point you to someone who might be able to help and sort of give a second opinion if that's not available in your immediate environment.
Question for Dr. Nygaard. This primarily relates to your graph showing the early amyloid deposition in individuals as they age. Are there differences in that deposition, whether you are male or female, and how is that modified by other factors such as lifestyle or exercise, and do we know the answer to that?
That is a great question. There seems to be some sex differences. So we know, for example, that 2/3 of people with dementia are actually women. Part of that is probably because women tend to live longer than men. But there's certainly in models very clear that there is a sex difference in that female sex is associated with a higher amyloid burden. Whether that's true in humans is a little less clear, but I think that is a very important issue, especially as you try to intervene with drug therapy. In terms of what can you do to reduce your amyloid load, so that is a very hot area, and I think you heard a lot of talks today about exercise, lifestyle, So the answer is we don't know yet, but we think that early exercise and a lot of intervention, including diet, has an impact on how quickly you accumulate amyloid. And don't forget sleep. So there's a lot of studies now. You saw that beautiful picture by Dr. Wellington where you saw how amyloid is cleared during sleep. And there's a lot of studies now, a lot of interest in trying to see if you can augment sleep. Can you therefore delay the onset of significant amyloid deposition in the brain? So great questions.
And thank you, Dr. Nagar. That's a great segue to the next question for Dr. Wellington. We had a couple of questions on sleep and how it influences amyloid, but what's the best way to manage sleep? Is it better to use medications? Does REM sleep seem to make a difference in the amyloid deposition? So a bit more detail on the effects of the type of sleep and the removal of clearance of amyloid.
What we do know is that sleep allows the vessel to flux out the amyloid as efficiently as possible. I'm not aware if we understand completely whether REM sleep or what the phases of sleep, the type of sleep patterns that are associated with most efficient amyloid clearance. It is a very, very active area of study. I don't know if any of the physicians would have any more commentary to make on that. But certainly making sure that if you're tired, sleep. That's probably a good thing. Yeah. Yeah.
This is not specific to one of the talks, but either perhaps Dr. Nygaard or Dr. Shung can answer. What is the role of inflammation in these processes in terms of amyloid and Alzheimer's disease?
That is also a very hot topic, and there are many indications that inflammation is involved in the neurodegeneration process. But exactly how it is involved is still a big question. There are some previous studies suggesting that decreasing the inflammation is good, but inflammation is like cholesterol. There's good inflammation and bad inflammation. So you need some good inflammation to kill germs, and the bad inflammation that causes bad arthritis. So exactly how to balance that is still a question, but so we don't have an answer.
And maybe we'll end off with our final question. Considering that, this is probably for Dr. Nygaard, considering that the amyloid deposits decades before the symptoms develop, is that really a good marker for this disease, or are there other better markers to indicate you're going to actually develop a dementia problem rather than just amyloid?
Who asked that question? The answer is we don't. This is a young science. We don't know yet. But there was a study that has not been published yet that looked at, so the general wisdom has been in clinical trials that 30% of people who have a positive amyloid scan do not have cognitive symptoms. And that has led a lot to believe that you can have significant amyloid in the brain and no symptoms. But the latest study on that indicates that if you follow those individuals long enough, they will get Alzheimer's disease. So we don't know yet. We haven't followed patients or subjects long enough to know whether if you're 40 and you have a positive scan, will you eventually get dementia, and what's the time frame? Stay tuned. But that's really where the field is heading. And I will say one note about sleep. We do have a study now looking at how we can intervene with sleep by sort of standardizing your meal times and getting your routine down. It turns out that your routine is really important for sleep as well. So if you eat at the same time during the day, if you exercise, those types of routines become very important.
Thank you very much, panel. You may be seated. Before Dr. Feldman says his closing remarks, I'll just... I'll just say a couple of housekeeping notes. One, make sure that you complete a card with your contact information to be contacted about future educational programs like this, if you'd like to be on a mailing list. A second form is a different form. is available if you would like to be involved in research trials, either clinical trials research, observational research, any of the research that our fellows are doing. Please put your name down. That's a separate form, so you must fill out a different form for that contact. Thirdly, make sure that those white devices that you were pushing buttons on, pretending you were still playing Pac-Man, you leave those on the desks, please. They will be picked up by our volunteers afterwards. And I think that's about all my housekeeping notes. Dr. Feldman will finish off to thank everybody and summarize what we've learned today.